Hi, my name is Beaubrun, and I'm a board-certified behavior analyst with Brett Zenobi & Associates. In this video, I'll be talking about trauma-informed care and applied behavior analysis. The ethics codes for behavior analysts that will be covered in this video are 1.05, practicing within scope of competence, 2.15, minimizing the risk of behavior change interventions. Trauma involves exposure to an event or series of events that adversely affects functioning and well-being. The adverse childhood experience refers to abuse and neglect, including exposure to domestic violence, substance abuse by a primary caregiver, or divorce. According to the Centers for Disease Control and Prevention, 61% of adults have experienced at least one adverse childhood experience. Children and adolescents in foster care or residential care and individuals with developmental disabilities are more likely to experience potentially traumatic events than the general population. Those who've experienced traumatic events may require trauma-specific services, which are individualized clinical interventions designed to directly address trauma-related symptoms. So what is trauma-informed? Being trauma-informed means to know the history of past and current abuse in the life of the client with whom one is working, and to use that understanding to design service systems that accommodate the vulnerability of trauma survivors and allow services to be delivered in a way that will facilitate consumer participation. The goal of trauma-informed care, then, refers more broadly to a universal approach taken by practitioners to appropriately support and avoid re-traumatizing clients who may have experienced traumatic events. An example of a trauma-informed treatment recommendation is considering a client's experiences. If the client has had a history of neglect and their problem behavior has been determined to be maintained by attention, rather than focusing on immediate contingencies such as extinction, the focus should be on skill building to teach appropriate attention-seeking behaviors. Another example is avoiding physical management for a client who's had a history of physical abuse. The effect of experienced traumatic events is generally conceptualized as an internal response to an adverse external event. In other words, how someone reacts anytime after a traumatic event has occurred. Although the trauma might have initially functioned as a punisher for a particular class of behaviors, like a child being spanked for making a mess, traumatic events can influence subsequent experiences. A barrier to discussing trauma in behavior analysis is that behavior analytic practice is focused on current contingencies, not how past events are impacting internal responses. In the Rajavarman et al. Article, they discussed how a possible framework to incorporate trauma-informed care into behavior analysis. These include acknowledging trauma and its potential impact, such as examining the current environment to assess if there are any similarities to the environment in which trauma experiences occurred, to determine if the environment may exert control over trauma-related responses. The second is ensuring safety and trust. These are difficult to provide an operational definition, but it involves establishing consistent routines and schedules of reinforcement. The third is promoting choice and shared governance, which allows the client to gain or regain a sense of control of their situation. And the fourth is emphasizing skill building. This puts an emphasis on differential reinforcement of alternative behaviors as opposed to differential reinforcement of other behaviors, non-contingent reinforcement, or punishment to uphold tenets of trauma-informed care and avoid re-traumatizing the individual. Thank you so much for watching. Please subscribe to our YouTube channel, and to disseminate the science, share this video.